I'm Dr. Stacy Sutton, a pelvic physical therapist and owner and founder of Sutton Health Advocacy. This video is one in a series called The Ins and Outs of Dilators that I've created in partnership with Milli for Her to bring you an educational session and series on how vaginal dilation therapy can help with a variety of pelvic-related conditions. In this video, I'm going to be talking about vaginismus. First, I'm going to go over what vaginismus is and the different types of vaginismus. And then I'm going to talk about how vaginal dilation therapy, or the use of dilators, can help specifically with vaginismus. Vaginismus is an involuntary closing of the pelvic floor muscles that makes it impossible, if not difficult, if not impossible, to insert anything into the vagina, whether it's a penis, a dilator, a Q-tip, a tampon, or to have a gynecologic speculum exam. So first, I want to show you the pelvic floor muscles. So all of these pink structures are your pelvic floor muscles. This is a view from the bottom, and then this is the view from the top. So you can see the muscles are concentric around the opening of the vagina. They create sort of like a hammock, and then there's the opening of your vagina. With vaginismus, as you try to insert anything into the vaginal canal, those muscles will close, often involuntary. And people who have vaginismus have told me that they feel like they have no control over this happening. So there are different types of vaginismus. There's primary and secondary. Primary vaginismus occurs is when someone has never been able to tolerate penetration of any kind, so has never been able to have penetrative vaginal intercourse, or use a tampon, or have a gynecologic speculum exam. Secondary vaginismus can develop after you've had, let's say a woman has had successful and pleasurable intercourse with a partner, and then seemingly out of nowhere, she can develop vaginismus with the same partner or with a new partner, or after going through menopause or a life change that somehow makes it to where now her body isn't as receptive as it used to be. Vaginal dilation therapy can help women with this condition. So the way it works is you use a vaginal trainer or a vaginal dilator, like the Millivaginal Trainer, and you would insert the dilator or the vaginal trainer into the vaginal canal, and then progressively over time, you would increase the size of the vaginal trainer or insert a larger dilator so that you can tolerate the size of your partner or a tampon or a gynecologic speculum exam. Now, when you're choosing what kind of dilator or what kind of vaginal trainer you should use if you have vaginismus, there's a few things to keep in mind. There is a dilator set called the Vaginismus dilator set. And what makes that unique is that it has a tapered end. But there's several other different types of dilators or vaginal trainers that also have that tapered end. So I'm going to show you several different types. Here we have the intimate rose. This is their first size, and you can see the end is tapered. These are the VuvaTech dilators, and you can see that end is tapered. Here's this Syracuse. This does not have a tapered end. And here is the Millivaginal Trainer, and it does have a tapered end. I want to show you what the tapered ends look like in the full size. This is the Millivaginal Trainer. It is expanded to size 25, which is its largest size. And you can see that there's a lot of taper at the end, which is helpful for inserting if you have vaginismus. I'm going to show you the largest sizes of the other dilators as well. This is the VuvaTech. You can see it has quite a bit of taper. Here's Intimate Rose. It also has some taper. And then last, here is the Syracuse, which is a great dilator, but if you have vaginismus, this can be a little bit harder to insert as it's rounded at the end. A lot of women have come to me and they already have a dilator set and they've been given the instructions to insert the dilator and leave it in place for 10 minutes. That's not really helpful or practical advice because the whole issue is how do you insert the dilator? This is different for each woman. So I really encourage you to consult your pelvic floor PT or your healthcare professional about how to insert the dilator. You can also DM me for a free 15-minute dilator educational session. If you want to know any more information about dilators, please follow me, DM me with questions, or follow @Milli for her. The information in these videos is for educational purposes only. It is not medical advice, and it is not a substitute for medical advice.